thank you for inviting me. It's a big honor for me, and I'm very humble. And I guess you invited me not as a president of the European Health Forum here, but as a former Director General of the Ministry of Health in Austria. And my role of Director General, I had the privilege to be in charge of the health system, the structures, the financing, the organizational part of the health system, not the medical part, but the organizational part. And I learned very, very early on, 20 years, 25 years ago, that digitalization is key to enhance the health systems. So that brought me to digital health. You know, I'm a political scientist. You know what I have to, I'm not a technician. I'm not a medical doctor. I don't know anything about all this. But I was convinced that this is the right thing to do. For some reasons, EHTEL and Mark and his team was always there. And this journey was, I can't think about this journey without having contact or being a member or whatever to EHTEL, because it was always a very, very important collaborating partner. So friends, my motivation back then, you know, because we are going, you know, title is Back to the Future, but back then, and I think it's still true for today, our modern healthcare system, especially in Europe or in all the developed countries, is a highly fragmented circus. It lives from medical specialization, you know, that drives also the progress and we have made over the last 50 some years. It's a very multi-professional setting, and it's very specialized. And I think we all know, and this is for certain parts still true, but 25 years ago, it definitely was true. The lack of flow of the information between the different healthcare providers was even a risk. It was a risk for the continuity of care, for good diagnosis, for better therapy, etc., etc. So what I learned very, very early on, and I remember that very vividly, a director of my department came to me and said, you know, Clemens, we have to connect all these many healthcare providers, outpatient, inpatient, pharmacies, etc., with digital means. And I said, give me a break, you know, I'm not interested. But then he came again, you know, with some other folk and who were in this circus, and they said, Clemens, you have to make that to your topic, and you have to coordinate the different stakeholders, you know, because not only the services are fragmented, but also the stakeholders when it comes to digitalization. So this is how it started. The why was very simple, because I think the flow of information is key for better health services and care and treatment and all the aspects involved. We did a very, I'm talking now about a little bit of Austria. We did a very early fact-finding mission with my minister back then to Finland. For some reasons, the Finns were always early starters here. And I remember very well, the government did put together a wonderful presentation and early morning session in Helsinki in a huge pediatric clinic. And they showed us live, you know, how this is working. The outpatient pediatrics and the inpatient pediatrics, and how they exchange information and what value that creates for the treatment and you know, especially for kids who cannot talk, you know, etc., etc., etc. And I remember very well, next to me at this presentation, so we had a small Austrian delegation, and next to me was sitting the vice president of the Austrian Doctors Association. And I said to him, Jörg, isn't that fantastic? I'm burning for this. You know, this is how modern healthcare should be, you know, interconnected. And he said, oh, yes, I see it, but I'm still against it. And I was asking, why are you against this? And he wasn't able to give me an answer. And I'll tell you another anecdote. I will tell you several anecdotes. Later on, I met Mr. Montgomery. I don't know if you know him. He was the German president of the doctors and then even the European and the world president. I met him once at the fancy dress balls we have in Vienna because we both were guests of honor and were sitting at the same table. And then he noticed who I am and said, "Oh, Clemens, you are this Mr. Elgar, electronic health record. And I'm opposing what you're doing." And I said, "Mr. President, why are you opposing that? It's advancing your services. It's advancing. It's not irritating your medical work, but it's enhancing what because you have better information. And if you have better information, you can be a better medical doctor." I said, "No. This is not what it is about. It's about transparency, and my peers can see what I do with my doctor, with my patients. My peers can see what I do and not do with my patients." That was his motive to oppose digitalization of healthcare services. I was shocked. And I tell this again and again and again, and I met Montgomery many times, and I always say, this evening you gave me a lesson, and I am telling this story. He's always a little bit irritated, but in the meantime, he is retired, and I'm also retired. But so here we already have 1 point. We have already at 1 point for the last 20, 25 years. The medical profession was not on our side. The medical professions were not on our side. And this fear of transparency, in Austria, the Medical Association, when we started implementing ELGA, they had an ad campaign in all the newspapers and on television, and they presented a naked woman and a naked guy, the naked patient. They wanted to fear the patients away from digitalization of this kind of services. So the how, so this is the why, it's very simple, and I think the why of digitalization in health is still true. The how is a little bit more problematic. And I think we all remember that there were many people who promised early successes and quick solutions and quick wins. I also remember, the whole board of Siemens Austria once came to meet my minister, and they promised us and said, "Oh, minister, within 2 years, we have digitalized and interconnected all the health services." And I also already saw the fire in the eyes of my minister, because politicians want quick solutions. And I had to kick her really hard underneath the table and say, "If you say anything now, then I'm out here, And because it's not possible. And you remember, some governments burned a lot of money with these failed promises of big industry to put something in place which didn't work. I also remember sitting in Sofia at the panel once, promoting digitalization, and there was a guy from ACFA, and he told this poor Bulgarian people there, not poor in terms of financial, but overwhelmed, "Buy my product and I can eradicate cancer in Bulgaria within 2 years." I was so shocked again, I was outspoken on the panel against that and said, "This is what you do here is really not good, and it's unfair to the people." So once again, as a Director General, I always had the privilege to really organize this whole process, probably along the golden standard of implementation, because first we had an organizational framework, then we had a technical framework, and the legal framework. And I was privileged enough to coordinate all these different frameworks. So probably that was also the reason why for several years we were quite good in that. Because, you need a strong organizational framework when you want to overcome projects and want to have national solutions. This was the time where we had projects, many, many projects, but we didn't have any really national solutions or larger regional solutions. And for that, you need an organizational framework. Who is responsible for what? You need technical framework. You need a good architecture. I don't, you are the experts here. You need, because it's health data, it's sensitive data, you need a good identity, authentication management. You have to do that. You have to set it up. You have to organize it. And because it's a fragmented world in healthcare, you need interoperability, because you already have infrastructure in place, but they have to interoperate, so to say. And what I also learned very, very early on, and this is, EHTEL, then of course in Brussels, you cannot do that alone. You cannot do that alone. If you want to create interoperability, if you want to follow standards, yes, of course, that was a time where HL7 was already in place and IAG started, thanks heaven, they started doing this with this beautiful connectatons they had, demonstrating to people like me that it works, if you create these things. Yeah. But what I always was worried that we create and implement something, I'm talking about Austria, which is proprietary, which is a national solution and is not working then in a larger context within the European Union, etc., etc. And there I have to say, this was one of the examples where the European Commission really did a wonderful job. They really did a wonderful job because they provided us in the member states with, I would like to say, a trial and error playground, a trial and error playground. Remember, we had EPSOS, one of the very first projects here. The results of EPSOS were not great, but what it created an e-health teamwork infrastructure across the borders with the member states, and good understanding also for the European Commission what is at stake. And I'm very grateful that they invested quite a bit of money, thanks heaven that the auditors didn't look very, very closely, but they invested quite a bit of money and they supported us in the member state to create this understanding of interoperability and standards and the necessity of all this. We had several joint actions and some of you remember that. And then we had a cross-border directive, this famous Article 14, if I remember correctly, with the creation of this eHealth network. I had the privilege to chair for 6 years, I think, because this is, then also all of a sudden we had a legal anchor. We had a legal anchor there on the European level, not only on the national level, but on the European level, to do something together and to create that. In the European interoperability framework, remember this national contact point stuff, etc., and patient summary, one of our products there, but the patient summary itself is not that it's important, but it demonstrated the necessity to have standards and norms in place so that that everyone can read it and can work with it and can fill it up, etc., etc. So that was the important thing. I was participating in a conference in Taipei recently in November, early November, and an academician from Melbourne, from Australia, came and said, how wonderful and important it is to have a patient summary. And I said, oh, Clemens, one of your babies here gets acknowledgement in down under, so to say, which is good, but once again, I did this trial and error playground. The Commission offered us and let us play, and their investment and their support, I think, was key. Let me talk a little bit about, and that's my favorite, and Petra probably is much more into talking about that, but creating this legal framework. Friends, we are not talking about project, we're talking about national solution, we're talking about the public infrastructure. This is my understanding when it comes to digital health, because we have public health systems. So you need a good legal base. The rule of law is very, very important. And since health data is sensitive data, of course, you need good legal protection, and you need protection of the data. So that's a technical question, but you have to put it in law. But you also have to secure the rights of the patients when it comes to their individual data, etc., etc. The question, which is unsolvable: who owns the data? And here we made a long journey. One of my things I really hated to do to go to the Austrian Data Protection Board with all these things. And there was a guy who was a data protection Taliban. And And not that I was always convinced as a political scientist that health data have to be protected the utmost possible. This was not, I never questioned that. But he always said to me, Mr. Auer, each and every digital data is a bad data because it has the potential to be misused. So we have to make it almost impossible to have digital data in place. That was his thing. And many people on this data protection board followed him. And he was the guy in the media. They loved him. So you can imagine, I had the data protection board against me and I had the media against me. Very wonderful. So, but what the point I would like to make early on, and we are talking about the 0 years and the early teens, so to say, data protection was all there. That was the most important thing, and then people like me who wanted to create a system which based on opt-out and not opt-in, because opt-in would be too costly and too slow. So I was really in struggle. I had a wonderful lawyer in my team who was a technician by himself, so he had a good understanding of the technical part. Of the technical part, and was also a good lawyer. So we were able to phrase that and frame that in legal terms very much. Because when it comes to the legal framework, you have three very important things. You need good language, legal regulatory language, but they shouldn't oppose the technical solutions and the usability of this thing. So you have to strike a balance there. And I think, and once again, Europe was important because there's a conference we are talking about a time before the data protection regulation, but the data protection authorities had a conference here in Brussels, and they put out a cookbook how to regulate digital health and especially health record systems. And I told my guys, use this as a cookbook and use their language. Because I want to go to my data protection people and say, no, I followed your advice, So the legal framework, I have to say, I was sponsoring many regulatory affairs, but these aspects of the health telematics to regulate that was probably intellectually the most rewarding thing for me personally. So in closing, I don't know, friends, how many times I traveled to Brussels on matters of e-health or digital health. It definitely earned me my lifelong senator status on Miles and More. So I'm grateful for that because even if I'm retired now, I enjoy the privilege of a frequent flyer. So I had no idea, no idea how many times I came here. But what I can say, without a good team of people, and I'm talking now the European context, a good team of people in the member states who are exercising leadership, nothing will happen. Because digitalization is not always in the forefront of ministers of health or the ministers of health. So you need individuals who are still driving the agenda and driving it over many years because there are no quick solutions because it needs a development. And for that, I think we all covered a tremendous journey and we achieved really something. The point, and we will have a chance to talk about that later, of course, there wouldn't be a European health data space without that long development we really worked on. And I think some of us here in the room, we can be very proud of us that we were part of that work and that journey. And for me, it was a privilege to coordinate that journey for a few years. And I'm pleased, to be very honest and not modest. I'm pleased with what we achieved so far. Thank you very much.